moderating this session. And we are looking forward to a very, very interesting discussion around a very important topic, that is non-communicable diseases and how the early detection can prevent them, especially through community participation and awareness. So, not wasting a lot of time and just starting with the questions to the panelists, I'd like to talk to Dr. Hirsch and just understand you have been in the sector for quite some time and you have been working on early detection. So what is your view? How do we scale this up in the public sector especially?
Thank you very much. At the outset, I must thank Veloxx Media for inviting me and the interesting discussions that we are having. Actually, I think the most important aspect is education and awareness when we talk about, preventing disease, predicting disease, to even know that it is possible to do that. At the physician level also, I think the awareness is not as much as is necessary. And at the general population level, definitely things are lacking. So what I've suggested over time to the government is that even in our school books, we should have a chapter, say class 6, 7, 8, where preventing disease, prevention and its importance should be brought in. Because without education, that health-seeking behavior to talk about wellness is not there. By and large in our country, we are always, when an illness happens, that is when we seek some kind of testing. Then the second thing, the simplest thing, checking blood pressure, checking blood sugar, heart rate, simple things which can be done, at the most peripheral of levels. If they can be done early on in life, there would be so many people who would be picked up with diseases. Then the programs and structured programs, be it organized health checks, where again NCDs, as we say, diabetes, heart disease, strokes, renal diseases, and finally cancer. There, I think starting, if we are able to divide the population into those at average risk and those at high risk, which may be dependent on the family history, on past history, on the risk profile for heart disease, hypertension, diabetes, all of that. So those who are at higher risk need to be looked at more diligently, because we have 1.4 billion population. Each one cannot be looked at through the same lens. So predictive medicine, which is coming into its own, where if out of 1.4 billion, we can pick out 100 million who may be at higher risk, they can be dealt with in a specific manner, focused manner. And we all know, starting 40 years of age, doing an annual X-ray mammogram in women, we used to say even till 5-7 years ago, once in 2 years. But if we see the way disease is galloping, especially breast cancer, and that too in the cities, women are nearly at twice the risk as compared to those in rural areas. So an X-ray mammogram, self-breast examination, again coming through education, which can be done at home. And then of course, the routine blood tests, lipid profile, LDL, thyroid function, renal function, liver function, an annual ultrasound of the abdomen. And now we are seeing increasingly what we used to dismiss as something, ye to hota hi hai, grade 1 fatty change in the liver. We are seeing that it leads to fibrosis, it leads to, ultimately cirrhosis. And it's not uncommon now. So not to disregard that. picking up diabetics early, those in the pre-diabetic stage early, so that lifestyle changes can be done, a chest x-ray, an ECG, and more recently with the use of digital technologies, artificial intelligence, ECG read automatically, x-rays, CTs, MRIs read automatically using artificial intelligence. These are the tools, but again I would say, things are expensive. So we have to prioritize for our population what needs to be done first, and most important, again I'll reiterate, is education and awareness.
Thank you, in fact, bringing in a very pertinent idea or maybe a suggestion wherein education can play a very important role in early detection and also managing and preventing any kind of NCDs. Thank you, sir. In fact, even
Here
the
I'll also
structured
say, sorry,
programs
I'm
that you
just
mentioned.
interrupting. You know, since school we've been taught prevention is better
Better
than
than the
cure.
cure, yeah.
But now, having grown up, we also realize prevention is much cheaper than cure.
Yeah.
And also, you know, you catch cancer stage 1, stage 2, it's a cure. Stage 3, 4, you're firefighting all the time. And apart from the morbidity and mortality, look at the expense, look at the man hours and man days that are lost, look at the trouble the entire
The
family
suffering,
goes through.
in fact. The,
Yeah.
uh,
So
patient
early
has.
diagnosis and prevention.
Yeah. So the motto is prevention is better than cure. Yeah. So moving on to our next panelist, Dr. Vartika. She has been into public health service since quite some time, and especially focusing on the NCDs. I would like to understand from you, Dr. Vartika, how do you see that early detection programs can reduce these challenges that occur, and how could the data that is generated through the early detection help in prevention of NCDs?
Thanks for your question, and at the outset I would like to thank Veloxx for having me here in this panel. And this is a very pertinent issue for Uttarakhand because you know, the NCD prevalence in Uttarakhand is much higher and much higher than the national average. We have a hypertension which is at least 8 points higher than the national average. So NCDs, that is a center stage for the state, and we all must come together to fight it back. And when you ask me this question that how the data can be useful, so first of all, I would say that if we are doing screening at a mass scale, we are generating huge data. And nowadays, data is actually the gold. And we are sitting on the gold mine. If without using that, it is a waste. So data can be used for developing the epidemiological insights. Because once you have the screening data, you can see that what is the prevalence of the disease, in which part of the state the disease is much higher in comparison to other parts. We can see that in which age group the disease is higher, in which gender and which sect of the society the disease is higher. So this helps us to analyze the risk factors for the particular disease, and once you have analyzed the risk factor for a particular disease, then you can appropriately target your strategies to that particular group. And once you have targeted, you have a targeted approach, appropriately policymakers, they can allocate resources for implementing that plan. And once you have implemented that plan, then predictive modeling based on the existing data, we can also see that if a strategy A has been implemented, then what is the result we are going to get? If we implement strategy B, then what is the change we are going to have? And that is how our policymakers can decide about these strategies vis-a-vis the cost to be invested in that. So that way I would say that this is a very important to collect the data and do advanced analytics for analyzing the data to have an appropriate strategy. The good example I can tell you for this data analytics, that every 5-year country is having national family health surveys. And these are the biggest survey, you can say they cover around 8 lakhs of household and 8 to 10 lakhs of population. And this is a huge population. And there are many indicators of NCDs which are being covered by these surveys. And based on the results and analysis of these surveys, we have come to know that diabetes is on rise, the hypertension is on rise. one very good and very important example I want to give to all, that based on these surveys, we have realized that in last 20 years, obesity is rising in our population at an exponential rate and much, much higher amongst women. So based on this feedback, our policymakers, they have initiated many health-related and obesity prevention program like Eat Right initiative, Fit India movement. And you know that just couple of days back, our Prime Minister has also mentioned that we have to bring down the obesity, we have to reduce oil intake. So such policy shifts happen because of these data only. And I would say this data based on rise in obesity amongst women. In the morning I was talking to you, we must start women-specific strategies to control obesity in them. And that could be one policy initiative because policymakers are here, so we can take it as a policy initiative for subsequent years to come. Another good example of large-scale data which we have related with NCDs is India Hypertension Initiative. That is also a country-wide program in which we are collecting data on patient prevalence of the disease and treatment adherence. See, in non-communicable diseases, it is not only just important to identify the case, but it is equally important that we are able to follow them up for emerging complication as well as follow up them for control of the disease. So this data can be used in many ways, and India Hypertension Initiative, this is using this data for appropriately designing the strategy to understand what are the reasons for non-adherence or non-compliance to the treatment, and accordingly they maneuver the changes in the particular region. So this is the use of the data.
Thank you so much. I think a key takeaway from here is that data is gold and we should use it for policy designing and also designing the programs that we are working on. One point that I would like to bring in from picking up the obesity part that you were mentioning, that the millet mission that Uttarakhand government is trying to drive can be a very good way to maybe control the dietary patterns or maybe the lifestyle changes that can be brought in the food habits of people. So definitely I think, thank you Dr. Vartika for bringing in these points. I would like to move on to Dr. Aakaar. You have been working in the sector, especially on the digital startups and how they can support the early detection of NCDs. And also you were mentioning about that whether they are measured well or not. So I would like to understand from you that what is the role of the private sector, especially in the digital startups in early detection of NCDs, and what are the KPIs that you foresee for seeing the impact of these early detection activities?
Thank you, ma'am. Thank you, Veloxx, for having me here on this prestigious forum. Lots to learn from all the key stakeholders. So, as a private sector, so I represent an organization which is more than 32 years into the field of diagnostics. So I also feel that I'm a radiologist myself. Rather than only catering to people, it's our responsibility to even give back to the society. Like sir mentioned, that we need to create awareness. As a private sector player, we feel that how we could do this is creating a lot of awareness by having camps in our area, spreading awareness with people in which they can get routine tests for the NCDs like thyroid testing, diabetes, sugar, cholesterol. So, and along with that, we do have always a physician who speaks with the patients, who tries to counsel them and discusses this with their reports with the patients. So it helps, and we do that at bare minimum prices so as to actually serve the society. That is one. Apart from that, the government is doing a lot of work, and the public-private partnership that everybody is talking about is really, we cannot do without that. The private players have to pitch in, and both have to go hand in hand to find innovative solutions. And without this collaboration, this would not be possible. Also, the digital health solutions, like for example, the wearable devices, the sensors, the self-monitoring devices that people are using nowadays to monitor their own glucose level, the ECG diagnosis made at bedside, and all these are helping reduce the burden on the healthcare system, which should ideally be used for critical cases. And finally, research and development. I feel research and development is the way ahead, requires a lot of capex and opex. So private players have a lot of role here in forming these new diagnostic tests, new medicines, as well as new devices, along with the medications. And finally, when we have these tools which are being made, we need to have KPIs in place so that we can keep a check as to whether they're effective or not. So few of the KPIs that are used frequently are A, the screening uptake rate, whether how many patients are coming ahead for the screening programs. This would indicate the awareness amongst people and their openness to be part of it. And apart from that, the diagnostic accuracy, which is of prime importance. These tests must give an accurate diagnosis if they are substituting for the routine testing. And also we have to see the cost-benefit ratio. The time to making this diagnosis, it has to be quick. It cannot be, a delayed diagnostic test, which it won't replace the routine test. And finally, the patient outcome. We have to, measure what the eventual outcome is, how it has impacted the mortality and morbidity. So I'll just give a couple of examples. Like in the United Kingdom, there was this NHS breast screening program, and they used the diagnostic accuracy and the patient outcomes as part of the KPI matrix. And also in Australia, there was a diabetes screening program, which monitored the time in which the diagnosis was made and the screening uptake ratio as to how many patients came forward to be part of this screening program. So these are few of the KPIs which I feel are imperative to these tools being developed.
Thanks, Dr. Aakaar. And I think it is again adding to the point what Dr. Vartika said, that data is gold, but it should be relevant, it should be appropriate, it should be timely captured so that it can be used for whether it is about taking the relevant actions or maybe even actually preventing the non-communicable diseases which we are focusing on. You wanted to speak something? Yeah.
I just want to add one point, that data can also be used for public messaging. As he was saying, that education is very important, but what to be educated, whom to educate. So that we need to decide based on the data available with us. Suppose we say that obesity is much higher amongst this age bracket of women. So these are the group who should be targeted for correct messaging for reducing the obesity. Then only we can be very effective in our approaches and efficient also.
Thank you. So bringing on that note, in fact, I'll bring in Dr. Prashaant here. He has been working in community campaigning and PR for NCDs, and he would like to share his experience regarding the community practices and also the PR and the relevance of PR, in fact, in prevention and control of NCDs. Over to you, Dr. Prashaant.
Thank you, ma'am. And firstly, thank you, Veloxx Media, to bring me here, and all the renowned personalities of the healthcare have gathered here to share their experiences. I believe that for a constellation of diseases that accounts for 63% of mortality in the country, of which 55% are premature and preventable, public awareness is of key importance. Like Dr. Harsh earlier said, that we cannot cover 1.4 billion population. So it is very important that the individuals are empowered to the right knowledge, that they know about their risk based on their family, based on their weight, based on their body composition, and also the risk factors or the symptoms of the diseases, so that they can also come forward for the screening, for the testing. So public awareness is of utmost importance. Secondly, yes, government is also doing, for example, from 20th February to 31st March, the government of India has initiated a special intensified NCD screening drive, and that is covering all the districts, and it is based on the screening of all the individuals age 30 years and above for diabetes, for hypertension, or for 3 cancers: oral cancer, cervical cancer, and breast cancer. So it is a 1.5-month long drive that is going on in the country right now. But community involvement is very important, and importance of private sector is very, it cannot be undermined, because the public health sector lacks in material, lacks in finances, and also lacks in the manpower. So private sector can play an important role. I will share you my experiences, like that Government of India is doing this initiative. What I have done in my hospital, that for every patient 30 years and above that comes to OPD, any OPD, whether it's an ENT OPD, psychiatry OPD, not only medicine OPD, he or she is screened for the non-communicable diseases. RBS is compulsory, weight, BMI is compulsory, and blood pressure is compulsory. I have made sure that the nurses write these vitals in each and every patient. So what happens, many a time the patient has come to psychiatry OPD for some another problem, and he or she is diagnosed with a high blood sugar. So that's why we are picking up the patients. Secondly, as an initiative for our hospital, I have initiated a scheme that is called Subharti Swasthya Grameen Mitra. This scheme is just on the lines of the ASHA workers, that is by the government, and we have covered 94 villages of our area. Each village has a Grameen Mitra. The Grameen Mitra has the work to screen the patients for these common NCDs. Like Dr. Harsh said, the cost of treatment is very high, but screening is relatively cheaper and also easier. For example, for diabetes, what we need? Just a glucometer to check the blood sugar. For screening for hypertension, we need to check the BP by digital sphygmomanometer. So the Grameen Mitra that we have volunteered, with the volunteer force we have, they go to the fields, they do the community engagements, they screen the population, and also they screen for the cancers, they inquire about the common symptoms, and if they see any red flag, they note it, and they report it to the physician in charge. So our team goes there, the physician goes there, have a small focus group discussion kind of thing, and the patients, they are picked, they are treated. So this, and also in the past 1 year, in 2024, we have organized 104 camps for community and industrial workers, screening about 17,000 population. We have organized 82 camps in different schools, and that screened about more than 5,000 school children for overweight and obesity, because they are increasing trend in adolescents for the obesity. And also we have one seminar or a focus group discussion session every month to spread awareness about these kind of issues. One thing I want to emphasize here as a private sector member, that if we talk of Ayushman Bharat is a wonderful scheme of government. But for NCDs, if we look in the Ayushman Bharat, the packages that are covered are very restricted for NCDs. Like for example, if we talk of diabetes, there is a package only of diabetic ketoacidosis, and there is a package of diabetic retinopathy. For example, hypertension, there is a package only of accelerated hypertension, and for diabetes also diabetic foot. So the main focus is on the late secondary and tertiary prevention. But if we want to treat these NCDs early, then I request the government to introduce some kind of packages for treatment of hypertension, uncomplicated hypertension or uncomplicated diabetes also, so that we can treat or control those individuals early. Because for tertiary care, the cost is high, the morbidity is high. So that part can be also looked into. So in the end, I would like to summarize that community participation, community engagement is important, and private sector role can be enhanced with the support of government, and the private players as a part of their corporate social responsibility can target by some innovative models to target the NCDs and to screen the population for NCDs. Thank you.
Thank you, Dr. Prashaant. So I think as we are moving through the discussion, it is very, very clear that prevention is better than cure and early detection. The data that is collected through this early detection can support right time treatment or maybe even strengthen the preventive ecosystem in the health sector. And as Dr. Prashaant mentioned, a lot of community participation can be done to really support the activities, and public sector can also be involved. One important point that he highlighted was regarding the Ayushman Bharat scheme, which the government has introduced, and how restrictive it is or maybe limited to support the early detection and also control of the NCDs. So we have Dr. Amit Shukla with us, who's from the government, and he has been involved in the public, private sector, public PPP models of healthcare in Uttarakhand. So I would like to request you, Dr. Shukla, to share your experience that how the regulatory system can be improved to create a conducive environment for early detection of NCDs, and what could be the possible funding models as well to support it.
Thank you, ma'am. First of all, again, I would like to thank Veloxx Media for providing this ecosystem and platform for a healthy discussion on the topic of health and all. Taking your question, ma'am, first of all, what avenues we saw when we were approaching in the PPP model. Basically the PPP model we dealt with was a holistic model, and it was one of a kind in the whole world, as being said by the World Bank team itself, and it was being done by the support of the World Bank team. What we did, that instead of having an isolated hospital and being run in a PPP model, we offered on our platform one of the district hospitals, 2 community health centers, and 3 mobile health vans. So that was envisaged that we'll be tackling the primary care healthcare in that local area with the help of mobile health vans, and then secondary care through CHCs, community health centers, and tertiary care through district hospitals. So taking one part of the example from there, that while running the MHVs in 3 clusters, we had a complete number which we touched was approximately 2 lakh persons, just near or very near their dwellings itself, that is in their villages. So out of that, somewhere around 60,000 people which we can touch upon were a fit case to be placed as under the NCD definitions and all. So through PPP we learned that earlier what we were doing was that we were just touching upon the curative part of, as Dr. Speaking earlier has very well said, that generally when we deal in the NCDs and all, we do have a well-oiled hospital being run in a PPP mode to address the cardiology problems. Our partners are Mediterranean, and it is being run in Coronation Hospital. We need to expand on that. And then we are running a few these diabetic and nephrology centers where we are doing diabetic care and all for these patients. That is also free, which was said by our health secretary in his address also. Some dialysis programs are going on, and more than 60,000 patients have been covered in that. So these are addressed or angled toward the tertiary care. But in primary care also we need to do, on the government side, on the public health sector side, some 1,847 sub-centers and PHCs combined, both have been turned into health and wellness centers, where the nodal person who is having a background in health, and they have been trained again on a 3 to 6 months training, and they are being labeled as community health officers. And this is the first point of contact, kind of, and they are also being encouraged to go into the community, as the earlier panelist also said, that they need to go into the community and then tap on the persons. So the communication is also being provided, and the services post communication are also being provided. Either they are on the hypertension, either it is on the basic diabetic screening on both the parameters, and even in some cancer screenings like cervical cancer and all, which already was there before the advent of Health and Wellness Center, but it is being rechristened and repackaged and all. So that covers one half of the question. That of course we are taking steps and reaching out to the community, and we need to develop in, but a lot of is to be done in PPP mode, because not much is being done in the PPP mode in the primary level, apart from some isolated approaches and all. As far as the regulations and guidelines are considered, Niti Aayog has come up with some guidelines. If we want to do PPP for NCDs, it's a 60-page guideline. I would request and encourage all the private sector partners. I would like to use that word, the private partners, because we all are partners, as Honorable Prime Minister and all the dignitaries have said that we are moving towards the whole of society approach. Earlier we were using whole of government approach, in which we were trying to break silos between health department, WCD department, education department itself. But I think we have covered a lot of ground in that, and now we need to go to the whole of society approach. My earlier panelist has said that their August hospital has been doing a lot of field work and all, so that is much appreciated. And of course there are always need of regulation. It's a mechanism and a process. It's always a road under construction, which we need to learn from our earlier learnings, and then we should have such a flexible approach from government side also to have these midterm learnings and accept them, and then we should have some of the measures that we can inculcate into the newer policies. The flexibility required from public health workers side or the public health system side is very much important, as you have said. As far as regulations are concerned, I would again say it's a continuous learning process, and I hope we'll have flexibility and humility to accept our understanding. Because even when two people meet and become partners in friendship or in life or in somewhere in business, it's hard to go along. And generally with the PPP, we mean public-private, but I would say in NCDs, since the morning we are taking new words of the meaning, we are digging meanings out of the words. So just give me the liberty to say that the first P should be people-centric as far as PPP and NCD is concerned, and it should be population-based. And if there is a PPP, the last P should be for profit-based. Because the private sector is coming, then it should be the private phase. It could be philanthropic also, but up to some limit only in an 80-20 ratio, which is, because I'm just saying 80-20 because the government of India also gives us funds in that manner only. So that could be done on that. And there is a lot of ground to be covered as far as the understandings of regulation and PPP is concerned. I would like to end just on a very positive note, कि मुमकिन है सफ़र हो वहाँ, कुछ हम भी बदल कर देखें, कुछ तुम भी बदल कर देखो. Thank you.
Thank you so much for that. So I think it's a very good point that you raised. In fact, we were having a similar discussion in the morning where we were talking about how it is important to really have a good communication between the government and the private sector to really establish good models for the partnerships. So taking again, while I'm summarizing the panel discussion and also moving towards the end, I would just like to pose a question to all of you. Picking up from Governor Sir's and also the Secretary Sir's point, that if you are focusing on she health, how do you look at the role of women in improving the outcomes or maybe preventing of NCDs? Because she health is important, but can the women themselves play a role in prevention of NCDs? So just open to all of you to have your views while we actually close the panel.
Because, you know, for NCDs, I know we need to have a family approach, and who is in the nodal position in a family? A woman. So woman is a person who is cooking, who is providing, nurturing to the family, and who can control also all the family members. So I think a woman becomes a natural leader for control of NCDs. And in ASHA workers, AIIMS, these are women who are actually bringing the change in the society. So women are the natural leaders, and they should be put as first person as far as NCD control comes. But definitely we cannot do it until unless men are with us.
A couple of points, like the first point that ma'am has raised, like in our organization, around 70 to 80% of the staff are women. We have staff strength of more than 500. So right from the reception staff to the phlebotomist, to the technologist, women play a very important role in directly interacting with the people, with the patients who actually need care. So those who they feel require that additional assistance, they are very important for us because they are that point of contact between the patients and our organization. And as a radiologist, there's an investigation which is gaining a lot of significance. If I talk about the NCDs, I missed out on that point, is a CT calcium score. So I wanted to highlight that because there are many people and we are seeing cardiovascular diseases, coronary artery blockages at very early stages nowadays, almost 20, 25, 30 years. So a lot of corporate health checks that we get are including this CT calcium score so that we can see the overall atherosclerotic plaque burden in the coronary arteries. So I feel that is one that people at risk must keep that in mind when going for routine health checks.
I would like to add what Dr. Vartika ma'am said, that role of women is very central because we have family approach. For example, most of the NCDs have the risk factor related to diet, and the woman is the one who is cooking for the family. So the role of woman is important. Secondly, most of the habits or the risk factors that are for NCDs that are adopted early in the life from children or adolescents. So the role of woman as a mother is important to discourage the children to adopt harmful lifestyles and encourage healthy lifestyles. So yes, the role of women in controlling, in preventing NCDs are of much importance.
Quickly, I would like to sum up in just two words. There are just two words, nature and nurture. 99% of the things are imprinted on genes, and as soon as the genes start to revolve, unless and until we go back to that level, not go back, we go ahead to that level, we do some genetic manipulation. Until then, there is only one way to take care of a pregnant lady, because as per the Barker's hypothesis has said, which is highly given a high regard in academic parlance, that everything starts in utero. Whether this kid is who's going to grow up, going to be a fit case for NCD or may evade it, the first footprint starts there only. So we need to take care of a pregnant mother, and all the ladies who are going to be pregnant or are in that bracket where they can go to that way, they needed to be taken care of. And if we need to take care of NCD in any way, we need to look at 1.5 generations which are yet to come. Because I think as far as prevention is concerned, we have almost lost that war for this generation, but we need to cater for the forthcoming generation. Yes, we can do a lot for NCD control for this generation and all. So thank you.
I think it has been a very insightful and interesting discussion. So if you look at, everybody's agreeing that NCD can be prevented and there could be a multi-sectoral approach that we need to adopt for really maybe preventing and controlling the NCDs in the state and also maybe across the country. So from Setu Aayog, I lead the social sector practice for Setu Aayog. And I would like to sum up like our Vice Chairman Rajshekar Joshi ji mentioned in the morning, that we really look forward and we really stress on the collaboration part. We are looking forward for private partnerships to come in the health sector in Uttarakhand, and Setu Aayog is really focused on supporting that partnership. So just summarizing and closing the discussion, Veloxx was really, like I should thank you for taking up the step to organize this event, and we look forward to working with you in future as well. Thank you all.